Turning now to health news, while cervical cancer screening rates declined over time, studies show that it has now increased among women under 50, including sharp rises among women ages 25 to 29. This year, it is estimated that there will be almost 14,000 new cases of cervical cancer and over 4,000 deaths. Joining us live over Zoom is OB/GYN Dr. Kameelah Phillips and Mindy Hylton, a cervical cancer survivor. Dr. Phillips, tell us about cervical cancer and the current rise in incidence rates.
Thank you for having me. So cervical cancer is cancer of the lower part of your uterus or your cervix. In that, we screen for it at your well woman visit using the Pap test. We're noticing that rates are on the rise because people are not coming back, in particular for their well woman visit. There's been limited access, and we're here today to talk about why it's important to come back and provide some more education.
Dr. Phillips, how does this underscore the importance of routine screenings?
Yeah. So I understand that the medical guidelines are always changing. It could be confusing, and it's really important that the guidelines continue to cover all options for women. And in particular, we're going to talk about HPV testing and the Pap test. So ages 21 to 29 get the Pap test, which is current screening guidelines say every 3 years. Once you're over age 30, we do what's called co-testing. That's your HPV test along with your Pap test, and that's every 5 years. Now, I'm not saying that you're going to come back every 3 to 5 years to your gynecologist. In fact, it's the well woman visit that you do every year that best allows us to screen you for cervical cancer.
Mindy, tell us your story as a cervical cancer survivor and what you were doing to empower women to get screened.
Yeah, absolutely. So when I was 35 years old, I went in for my annual exam. I went every single year, and this year wasn't any different. I didn't go because I was having any signs or symptoms or pain. It was just my annual well woman checkup. And at that appointment, they did the Pap HPV co-testing. I left that day thinking I was healthy and everything was just fine, because it always had been. About a week later, they called me and said that I had abnormal test results. So I came in, we did a little more testing. We did a biopsy on a small spot, and that's when they told me that I had cervical cancer. So because I went every year, I got tested annually, that allowed us to find the cancer very, very early. That early detection, we went in and the spot was so small that we were able to get all of those cancerous cells out, and I was able to live a healthy life. 1 year later, I actually had my daughter, so she's now 7 years old. So I'm very lucky that I have a happy story to tell and to share, and that's what I want to do to advocate, is to share that story and empower other women to make sure that they're going to the doctor annually, that they're scheduling those exams, and they're coming up with a testing plan with their doctors.
You want to have more happy endings like yours. Where can we go for more information?
Yes, so I direct patients to evidence-based sites, and this one is hologic.com/wellwoman, HOLOGIC.com/wellwoman. There you can learn about Pap tests, HPV testing, co-testing, all the lingo that you need to discuss with your doctor at your well woman visit.
Thank you both so much for joining us. And Mindy, we're glad to hear that you are doing so well now.
Thank you.